Welcome to our 5 minute session. Today, we will discuss the association between sexual objectification, insomnia, and affective symptoms. As we start, I would like to ask everyone to think of the most recent insomnia episode you experienced. What are the thoughts running through your mind when lying in bed? Is it related to academic stress, relationship problems, or traumatic events you experienced in the past? And after a long, painful night staying awake, what are the consequences you may face in the following day? Given that sleep takes up about 1/3 of our lives, it plays a vital role in maintaining humans' proper survival functioning. However, insomnia, difficulty in falling or maintaining sleep, is a highly prevalent health issue, with nearly 1/3 of the population suffering from it. Previous research revealed that insomnia could negatively affect physical and psychological well-being. However, our research team also noticed that existing knowledge was limited in studying the socio-psychological perspective of insomnia. Thus, we aim to investigate how social maltreatment plays an essential role in predicting insomnia. With data suggesting women experience one episode every 2 days, sexual objectification is a stressful experience for females as they are dehumanized and only recognized based on their appearances or sexual functions to fulfill men's desires. These incidents could occur in public when females received catcalls or their body parts are being stared at or commented. Therefore, sexually objectified women often possess higher body shame and often experience negative emotions. Thus, sexual objectification influences women's psychological well-being and leads to higher perceived stress. According to the hyperarousal model of insomnia, psychosocial stress is one of the hyperarousal factors associated with poor sleeping environments, which triggers episodes of insomnia. Other longitudinal and experimental studies also found that perceived stress is negatively associated with sleep quality. Therefore, we proposed that sexual objectification and insomnia are connected through perceived stress. So, what are some adverse outcomes commonly observed among insomnia patients? Research showed that a lack of sufficient sleep disturbs cognitive functioning and obstructs one's ability to buffer against stressors. Therefore, they are also more vulnerable to affective symptoms, namely depression and anxiety. Additionally, our research team also investigated a dispositional characteristic that moderates the mediation role of perceived stress and insomnia. The sex is power beliefs. It is defined as women's subjective beliefs that they can acquire the power to control men through sexuality and beauty. Previous findings have revealed that women with strong sex is power beliefs indicate better sexual experience and advances. They also reported higher sexual well-being and higher acceptance towards sexual objectification experiences. Therefore, we hypothesized that sexual objectification predicted higher perceived stress and insomnia, thereby leading to more affective symptoms. We also proposed that only women with weak sex is power beliefs will be troubled by the above mediation effect, as they might experience difficulty in dealing with negative consequences after being sexually objectified. In our study, participants completed a list of validated measures examining their sex is power beliefs: sexual objectification, perceived stress, insomnia, depression, and anxiety. Then, various statistical analyses were conducted to test the associations between these psychological constructs. As predicted, the results showed that sexual objectification was positively associated with perceived stress, insomnia, depression, and anxiety. Moreover, perceived stress and insomnia serially mediated the association between sexual objectification and affective symptoms. Furthermore, sex is power beliefs moderated the serial mediation effect, as the effect is only observed among participants with weak sex is power beliefs. To conclude, our studies filled the research gap by showing sexual objectification as a socio-psychological factor that causes insomnia among women. We also reviewed the underlying psychological mechanism of perceived stress and insomnia leading to affective symptoms. The findings highlighted the role of beliefs as a possible way to weaken the negative consequences of sexual objectification. This is the end of our presentation. If you would like to learn more about the study, you can scan the QR code to read the full article. Thanks for listening, and see you next time.